Next up is Annie Lee, who is a student at McMaster University in the Health and Sciences program. In her local community, Annie volunteered at South Lake Hospital and at the Peter Gilligan Center for Research and Learning at the Sick Kids Hospital. In her free time, she loves to go on hikes, paint, and write songs on her ukulele. Here she is with her presentation of the technological demands on the healthcare system.
As technology continues to improve and open endless possibilities for development, healthcare has similarly followed in light of its recent advancements. Technology is an essential component of modern medicine and has helped improve and save the lives of many. Especially during a global pandemic, the need for technology, not only in terms of sophistication, but also in terms of quantity, has never been more apparent. Global shortages of crucial devices and apparatus have since galvanized a variety of institutions into action to research and develop refined alternatives while simultaneously attempting to bridge the shortage gap with existing technology. So today's presentation will first provide an introduction to the role of technology in healthcare and further expand into the technological demand present during the pandemic. And then finally, I'll conclude with the disparities in access in technology and its effect in dire times. So a variety of different kinds of technology are present in the healthcare system. These devices, machines, and tools are important to both the patient and the healthcare provider and are used to either help diagnose, treat, support, or protect either the patient or the provider. Technologies used on patients primarily consist of diagnostic and treatment technology. Diagnostic technologies are used to determine the root cause or nature of a medical phenomenon, whereas treatment technology is used in attempts to address or solve the phenomenon that was previously identified in the diagnosis. Examples of diagnostic devices include magnetic resonance imaging, temperature sensors, or X-ray scans. In the case of COVID-19, testing kits are utilized to identify individuals who have been infected by the virus. In terms of treatment, while there is no known cure for COVID-19, devices that offer supportive therapy, such as ventilators, help patients breathe and maintain essential bodily functions in hopes of recovering. Technology that is primarily used for healthcare providers, especially in light of the COVID-19 pandemic, is protective technology. However, other technological advancements have helped increase the productivity and availability of healthcare providers as well. While equipment such as gloves, medical masks, face shields, and gowns do not have any electrical circuitry, there are still devices that are vital to protecting healthcare workers on the front lines. Other technological advances in recent years, such as augmented and virtual reality, artificial intelligence, and telemedical robots, are also helping frontline workers tackle the novel virus. These devices can aid in healthcare workers with their mental well-being and psychological well-being, and can also be used to train new healthcare providers as well. Moving along to the technological demand during the pandemic, the onset of the COVID-19 pandemic has undoubtedly created an increase in demand for technology within the healthcare system. As hospitals and institutions rush for life-saving resources, many regions are still experiencing a shortage of essential equipment and technology. The demands placed upon the healthcare system has outpaced the system's ability to provide these coveted medical supplies. Devices used to diagnose illnesses are equally as important as the devices that are used to treat those same illnesses. However, limitations to the diagnoses that can be performed have adverse effects on a population in times like a pandemic. Tests for COVID-19 are being increasingly demanded with insufficient resources to support this demand. One of the main reasons for this shortage is the diminishing supplies of essential components that are needed to perform these tests. Chemical reagents, which are required by laboratories to complete COVID-19 tests, are now in short supply and are struggling to keep pace with the growing demand for tests. As well, a lack of trained personnel to complete these tests also contributes to the backlog of COVID-19 diagnoses. In Ontario, over 500,000 medical tests were performed daily, even before the pandemic. Now, with the surge in COVID-19 testing, laboratories are becoming overwhelmed. Countries worldwide are experiencing shortages of tests for the novel virus and are therefore unable to identify the infected individuals. This leads to an inability to track the virus and later potentially the inability to properly contain its spread. Due to its importance, this surge in demand for testing kits and subsequently its shortage has also increased the demand for technological innovation with regards to the diagnostic devices for COVID-19. This pandemic has mercilessly demonstrated the shortcomings of existing diagnostic devices and medical testing infrastructure, as seen through the growing shortage of tests that are available to patients. To combat this, various biotechnology companies, institutions, and organizations are working to develop unprecedented methods to help test and diagnose individuals using advanced technology, such as the recently discovered CRISPR gene splicing tool. While there are currently no known effective treatments for the COVID-19 virus, different kinds of medical technology can still be used to help support a patient in hopes of recovery. One of these devices is a ventilator and is considered to be supportive therapy for patients staying in the intensive care unit or the ICU. While not all patients infected by COVID-19 will require hospitalization, approximately 1 in every 5 infected individuals will develop severe difficulties with breathing and require to be admitted to the ICU. However, when the pandemic first began infecting countries and communities around the globe, a substantial amount of ICU beds were occupied by patients with critical conditions other than the COVID-19 virus. By now, operation rooms, waiting rooms, and even parking lots have been refashioned into alternative ICU spaces due to the overflow of COVID-19 patients. While the space for more beds has been exhausted, the number of ventilators available for patients is far fewer than what is needed. Some hospitals were forced to decide which patients would be fortunate enough to be admitted to the use of a ventilator, while others were left to their own devices due to the limited resources available. Countries in which governments had previously invested in additional ICU resources were subsequently less affected than those that did not. Similar to diagnostic technology, this shortage of life-saving devices has galvanized institutions and created an increased demand for technological advancements and innovation. Devices such as modified versions of traditional ventilators, like the variable positive airway pressure machine, are being developed to increase the ventilators available for COVID-19 patients. As well, a number of health institutions are also racing to develop a reliable vaccine as a cure to the current pandemic. While the health and well-being of patients are important, the safety of healthcare workers is equally as significant in the fight against the COVID-19 virus. With a shortage of personal protective equipment, or PPE, medical personnel are at a heightened risk of infection since they are constantly exposed to the virus on a daily basis. This makes the lack of PPE a dangerous situation for both the healthcare provider, their families, as well as others in the hospital. Based on an estimate by the World Health Organization, it is predicted that approximately 89 million medical masks are required monthly amidst the COVID-19 response. In terms of gloves, 76 million are required each month, and goggles are demanded at 1.6 million per month. Breakages in the supply chain and surging prices have limited supplies of PPE in many regions and has contributed to its existing shortage. To combat this, communities across the globe have been utilizing other typically non-medical technological devices to help lend a hand in the battle against PPE shortages. One of these initiatives includes the crowdsourcing of 3D printing masks for healthcare personnel on the front lines. As heightened demands have made it harder for hospitals to receive PPE from formal suppliers, certain individuals have made 3D printing files for masks, goggles, and other essential PPE available on the internet so that those with access to 3D printers can help bridge the gap in the supply chain. While COVID-19 patients have recently been the priority of many healthcare institutions, it is important to not overlook other patients that require help unrelated to the virus. Unfortunately, the pandemic has undoubtedly impacted the medical routines and needs of many individuals and has resulted in detrimental effects on these patients and their families. As aforementioned, ICU beds and resources are all being gathered in efforts to fight the COVID-19 pandemic. However, it places these resources in short supply for patients who are not affected by the novel virus. Operating rooms have been turned into ICU rooms, and surgeons and other specialized medical staff have been redirected to other departments to treat patients who suffer from the COVID-19 virus. Due to these changes, approximately 1 in 4 cancer patients have reported delays in their care due to the pandemic, causing adverse effects on their recovery and even resulting in death. Organ transplant surgeries have also been heavily impacted since the conversion of operating rooms into ICU facilities and after hospitals have been overwhelmed has limited the ability to remove organs from donors and perform transplants. While there is a shortage of technology to treat patients infected with COVID-19, patients with other serious medical conditions are also not receiving the care that they need and become non-virus related victims of the pandemic. Aside from more technologically demanding health conditions that require surgeries or ventilator support, many individuals are also hesitant to visit hospitals out of fear that they will contract the virus. Even if there are genuine medical concerns, patients will often opt to stay home instead of seeking medical attention. To combat this, a new program that certain hospitals have adopted is the integration of telemedicine into healthcare services. Through telemedicine, healthcare professionals can consult patients either through voice or video calls and provide contactless care from a distance. Primarily used for less critical medical concerns, telemedicine has taken full advantage of modern technology to help ease the current technological demands of the healthcare system. Moving along, the demands for increased quantities of health technology have been rapidly rising since the start of the pandemic. However, certain communities are disproportionately affected due to their lack of adequate health resources. While large urban hospitals are struggling to manage the large influx of new patients each day, those in rural regions are inadequately equipped to combat a pandemic outbreak. Residents in rural regions have fewer resources of healthcare and fewer healthcare professionals and hospital beds per capita. They also tend to have an older population and a higher rate of obesity, both of which are factors associated with an increased risk of mortality from the COVID-19 virus. However, a large contributor to the morbidity and mortality surrounding the virus is, in fact, the shortage of ICU facilities with ventilator support that is available to rural areas. These regions have historically experienced the detrimental effects of limited health resources, as previously seen in high H1N1 mortality rates seen in rural Turkey, in which these high rates were directly linked to the deficiency of advanced ICU facilities and a shortage of ventilators. Additionally, individuals living in rural regions that are less developed or less wealthy may also have limited access to luxuries such as laptops, phones, or stable internet connection, which are all necessities required for telemedicine. This lack of technological resources, both in hospitals and in homes, has the potential to hinder local pandemic recovery. Other communities that experience disparities in access to health technologies include the Indigenous community and homeless communities. Both populations are already struggling with barriers to health, including but not limited to access to clean water, housing, and poor mental health. Indigenous communities are faced with poverty and poor socioeconomic conditions that limit their access to technological resources needed in order to help fight the pandemic. Furthermore, homeless individuals are also at an increased risk of infection due to the lack of safe housing and are also limited in their access to potentially life-saving technology. The demand for technology extends beyond that of urban epicenters of the pandemic. In ill-equipped regions such as rural areas, Indigenous communities, and homeless communities, many individuals do not have access to the same tools and devices provided in urban centers. While there is still an increasing need for technology in these communities, the healthcare systems in rural regions, Indigenous reserves, or in the homeless community are unable to supply and meet this demand. Ultimately, technology has proved its part as an essential component in battling a pandemic and has shown how detrimental consequences can follow in its absence. Moving forward, continued investments into the development and advancement of technology are necessary to create an increasingly pandemic-proof world. Thank you so much.
Awesome. Thank you very much. That was a great presentation, Annie.